Okay, so welcome everyone. Thank you all for joining us today. So as Texas is reopening and allowing small businesses to return to workplace, many of you might still wonder what are the extra steps that you can take to ensure the safety of your employees and also customers. So today in this webinar, you will learn how to prepare to reopen your business safely by following a standard health protocols. And this webinar will be recorded, and at the end of the presentation, we will also leave some time for Q&A. So please type down your questions in the Q&A box below. This webinar is in partnership and also co-hosted by the City of Austin's Economic Development Department. I would also like to thank our corporate partners for supporting the Chamber's programming. And our event sponsor, ATX Environmental Solutions. Today, I also have Paul Kim here to join in with us. Paul is the president of ATX Environmental Solutions, and he's going to speak for a few minutes about his disinfection services. So welcome, Paul.
Thank you. Let me see if I can get this, hold on. Everybody can see this?
Yes.
Okay. Well, my name is Paul Kim, and I'm the owner of ATX Environmental Solutions. And I'm also the current board member and ex-chairperson for the Great Austin Asian Chamber of Commerce. And I'd like to thank GAACC for giving me this opportunity to take part in this event, and also to tell you a little bit about what our company does. And I know some of the materials may be a little bit duplicative of what you'll be hearing later in this webinar, but this is how I practice my presentation. So if I have to go by how it is, otherwise I'll lose track. But so bear with me. And we all know like what kind of havoc this COVID-19 pandemic has created in all aspects of our lives. And I don't to tell you the toll it has taken on our personal lives and our businesses. I have summarized some data for some other purposes on economic effects and pandemic in Texas, also corona case status, and how it's trending up at the moment. But I know all of you are sick and tired of numbers and data by now. So I'm gonna skip it, and I don't want Ishan yelling at me later for going over my time. So I'll skip this part. And I'll make this presentation available to anyone who wants it later. As these numbers indicated, we're setting records on high numbers, new corona cases everywhere, but this reopening train seems like it has left the station and it's rolling down the tracks, whether we like it or not. And it is very important, I think, to remember that reopening does not mean COVID-19 is closed. From economic standpoint and the general, judging by the general societal attitudes, reopening businesses are inevitable. And when we reopen, I think we have to employ smart strategies. And I know we have these experts who are more versed in this arena than I, so I'll leave this strategy part to the experts. But reopening strategy must be multifaceted. And there's not one thing that is more important than others in all these different actions that you take in your strategies you adopt. Wearing face masks, washing your hands, temperature checking, mandatory social distancing, are all important elements. And disinfecting the working space, whether your business is type that deals with the public or not, is a key aspect, we feel like, in protecting your workspace. And ATX Environmental Solution, we employ a disinfection system called SteriMist. It is different than your ordinary conventional disinfecting methodology used by many vendors out there right now. We use ionized hydrogen peroxide. It is broad spectrum disinfection method originally developed by U.S. Department of Defense to combat anthrax, Ebola, and other pathogens used in biological weapons. It is FDA and EPA approved and registered and has 99.9999% efficacy rate, which is a kill rate against most bacteria, viruses such as SARS, staph, norovirus, H1N1, and most importantly, COVID-19. It is completely non-toxic and completely residue-free, requiring no wipe downs after the application. People with sensitive to chemicals do not react to this. It is completely safe to use on any sensitive office equipment such as computers, keyboards, even your food prep areas. And another good thing about this is aeration time is very minimal, meaning you can return and reclaim your space almost immediately after the treatment. What originally caught our attention to this SteraMist was that it was declared the official decontamination technology of Seoul, Korea metro transit system. And I go to Korea often and I rely on subway 100% of the time as my mode of transportation. And I know how crowded it gets on those Seoul metro subway system. And it is a true validation of how effective this is for them to adopt the system to safeguard their subway system. And recently, I know all of you know that Korea has been setting standard on protecting and fight against coronavirus. We ionize 7.8% hydrogen peroxide by passing it through cold plasma. And when applied, ionized hydrogen peroxide is carried by gaseous mist, penetrating any microscopic barriers, leaving no cracks or crannies where virus might be hiding and untreated. Coronavirus in itself is very easy to kill, but the problem is how small it is and how invisible they are. The fact is, coronavirus is about 100 times smaller than your normal average bacteria. And we know how small bacteria is. It's only visible through a high-powered microscope. Because of the pure size of the virus, the only way to truly attack virus is through a microscopic cellular level treatment where a radicalized agent attacks virus by causing cellular disruptions. And that is basically how ATX SteraMist works. And we recently launched the drive-up vehicle disinfecting service. And every Friday, we're offering complimentary personal vehicle disinfection service to frontline healthcare professionals and first responders on every Friday. And by enduring, our drive-up disinfecting service for your vehicles is available through Monday through Friday, 9 to 3. And just because you endured through this presentation with me, if you mention this webinar and GAACC, we'll give you a free first-time treatment if you come to get your vehicles disinfected. Instead of washing your car, disinfected is our motto. Dirty car will not kill you or make you sick, but infected car will. So instead of washing your car, disinfect it. Our contact information is available on this presentation and also on our website, atxesl.com. And or simply just call us at 512-452-2701. Again, I'd like to thank GAACC and everyone that's attending for listening through this and giving me an opportunity to present this. And I hope you enjoy the rest of the webinar.
Thank you so much, Paul. I really appreciate your introduction of your service and also your generous offer to our GAACC members. So if you have any questions or if you need any services, please feel free to contact Paul and his company. So now next up, I would like to introduce today's two speakers, Vienna Louise and Cassie Wilson. So Vienna is the founder and also the president of 360 HR Consultants. She is a certified senior professional in human resources. And she's also a strategic and innovative HR business partner with a proven record of building strong partnerships and charting strategic direction that helps small businesses to meet and exceed their goals. Vienna has over 12 years of HR experience, and she's also experienced in working with clients who are from various industries. So welcome, Vienna. So Cassie Wilson is also our speaker. Cassie is a senior HR consultant in Employer Flexible, and she's also a certified HR professional. Cassie's role at Employer Flexible allows her to proactively consult with leadership teams to evaluate HR needs and improve process. GAACC also uses Employer Flexible services. They are really a great HR company to help small business with handling their own HR issues. So if you have any questions about the PEO service, please feel free to reach out to me or Marina. We will be happy to help you to connect with them. Cassie is also passionate about utilizing her HR knowledge and experience to deliver positive change throughout organizations and also to help small businesses to grow. So now I would like to hand it over to Cassie. So welcome, Cassie.
Thank you so much for that introduction. Give me 1 second here. I'm going to share my screen with you all. Okay, wonderful. Well, good afternoon, everyone. Today, I'm going to walk you through just a little bit of preparing your workplace for returning to work. I'm going to look at the physical workspace perspective, and then Vienna is going to take over after me and focus more from an employee and customer perspective. So the first thing I want to point out is just a couple resources for you all. And we are going to share our slides. So you'll have these links available to you. Throughout the COVID pandemic, Employer Flexible has been creating a resource page with lots of different links, information, and templates that you can use for your business and for your employees. One of which is actually a return to work guide. And this is a comprehensive guide that really highlights the steps to take in order to safely bring your employees back into the workplace. We're going to touch on these today, but kind of nice to have it all in one place, embedded with links and templates and things that you can utilize. I've also put the link out here for the Chamber's resource page. They have some great COVID resources out there as well. And then it's important to note that really during this unprecedented time, you also really need to stay up to date on any official guidance from OSHA or from the CDC. As we all might be aware, things can change day to day. So very important to always be checking out there for the latest and most updated guidance. For example, the CDC recently released a roadmap of critical tasks to take prior to reopening your business. So I've put that link here for you too.
Cassie, sorry, are you sharing your screen?
Oh, I'm sorry, can you not see it?
Yes, that's okay.
Let's try that again. Can you see it now?
There you go, perfect.
Okay, sorry about that. Okay, so links are out here for you. And like I said, we're gonna share those with you. Also, one thing I just want to note very quickly is whatever I'm going to go over today is really just a general guideline. It's not going to encompass any state or local orders outside of Texas. So it's really important to understand that applicable state, local ordinances, guidelines can dictate, and actually many have specific steps that companies must follow based on their local guidance before opening your business. So just be mindful of that. Now, when we're planning to reopen, the CDC recommends that employers begin planning even before they open their offices by maintaining, of course, open communication with building management and reopening only once the physical workspace is ready. And one thing to note is any reopening plan should really account for some of the unique hazards that may have arisen as a result of leaving our buildings unoccupied for weeks, even months in these cases. Things like mold, even rodents, bugs, stagnant water, things that normally we probably wouldn't think about. But really the first real step to preparing to go back into the workplace is to evaluate workplace safety. So prepare that safe return, communicate this plan to employees and customers, and doing so can actually help reduce some fear and increase some brand loyalty as well. So the first step to that, and my recommendation, is to develop a pandemic response team. Now, if you don't have the human resources to have an entire team dedicated, at least designate one safety lead who is going to be the point person on taking the lead and making sure all these steps are in place. So as an example, just at Employer Flexible, our team has been meeting weekly to prepare our building, develop safety practices, policies and procedures, define possible exposure protocol, and then of course, communicate these plans back to the rest of the organization. So when we talk about preparing the physical workspace, as I mentioned, the CDC does have a checklist for you, but really the main components that we want to think of are ensuring that your HVAC systems have been maintained. And to do that, we want to check the air ventilation, replace any air filters to ensure that you have some clean air circulating through your business. The next step, obviously, as Paul mentioned and described to us, is we need to sanitize our workplace before we start bringing employees back. So most companies that I work with are hiring external services like Paul's to come in and sanitize your workplace. If you do decide to do it on your own, highly recommend that you go out to the CDC website, because there's certain disinfectants that are approved or not approved, and you want to make sure that you're following the right guidelines. The next thing to think about when you're preparing the building is to rearrange the physical workspace. So think of any common spaces. Maybe you have reception areas, routes of entry or exit, meeting rooms. Maybe you have a cafeteria or a break room, really any area where employees may congregate. We want to find a way to reduce the foot traffic. So maybe close off some of those rooms and not make them available when employees start returning. Also, if you have elevator access or any high-touch communal items, think the coffee pot, maybe we want to pull those back for a little bit until we get back to a new normal. As far as the actual workspaces, so try to keep employees 6 feet apart. If you can't physically move the workspaces, then I suggest just putting a notice on every other cubicle so you're maintaining the 6 feet. And if that is not at all possible, then kind of as a last ditch effort, you could also install shields or a physical barrier to make sure employees are not too close together. Are there any questions up to this point? None yet? Okay, great. So the next question that your pandemic response team is going to address is whether to screen or not to screen. So you at least want to consider implementing some sort of screening practice, whether that be actual temperature checks, COVID testing, or even just a self-certification or questionnaire. I highly recommend checking out on OSHA's website at their worker exposure risks. That can really help determine what makes sense for your business depending on the risk profile. At the very least, what I'm seeing most frequently is some sort of questionnaire that employees or vendors or visitors are filling out before they enter the workplace to certify that they are not having any symptoms, they haven't been in contact with somebody who's positive, things of that nature. And if you want a template, they are out on the website, or else you can email me for that. Next, you need to consider who is going to be responsible for performing these screenings if we go that route. Once we determine that person, of course, they're going to have to be trained. We have to notify them of any possible implications of being that point person. For example, possible exposure for being around an employee who might be positive. And then we need to train that person that it's absolutely imperative that they be consistent in their practice. So if we are screening, then we are screening the entry-level employee and the CEO. And of course, we want to keep any medical documentation confidential. Now, just a quick note, if the CDC or the public health officials revise their direct threat standard of the pandemic, that means that screening would no longer be permissible and would be considered a medical examination under the ADA. I have not heard any rumblings that that's coming. I'd just like to point that out. Also, we want to talk about personal protective equipment, or PPE. Are you going to require that your employees wear PPE? I'm not sure if you've seen the Austin ordinance that came out yesterday. The mayor discussed that he's going to potentially require all employers to have employees wear facial coverings when they're in the office. San Antonio just did the same thing. So we're seeing that a lot throughout Texas. But you still want to think too, beyond that, are you going to require gloves, face shields? Again, OSHA's exposure risk is going to be the best resource to determine whether that's right for you. And if you do require it, we have to train employees on who is responsible for paying for this PPE. Are you providing it, or our employees? When do they need to be worn? How to properly clean them, and how to properly dispose of them. Now, we're going to walk through establishing physical distancing measures, adjusting the work environment. We talked about increasing the physical spaces between, allowing telework whenever possible, flexible hours and staggered shifts. We'll talk about that a little bit more. But one thing to note is virtual meetings. What we're doing right now, I think a lot of businesses have gotten very comfortable with the virtual meeting. So whenever possible, any non-essential meetings should be held virtually versus in a break room with all of your employees congregating together. Consider implementing a no handshake rule, and then maybe not allow visitors, or at least establish a protocol that limits the number of visitors in your area at any given time. So in addition to safety measures, we also want to consider a controlled approach for how we plan to recall any furloughed or remote employees back into the workplace. So I suggest you consider returning employees in phases. So for example, you could send out a survey to all your remote employees and kind of gauge their readiness to return. Those that are, really anxious to get back into the office, maybe we bring them back first and start phasing in after that. Just note that if you do a phased approach, you can only consider non-discriminatory factors when you're bringing those employees back. So things like inability to telework, essential nature of the role, their seniority. You do not want to make assumptions about someone's level of vulnerability to the virus. So we're not going to say we're not going to bring somebody back because they might be a little bit more susceptible or vulnerable to COVID. For those that you do recall, think about if you are going to give them some leeway, or if you're going to have strict deadlines on when they need to return. So for example, you could send out a letter saying you need to come back by this date, or else we'll assume that you've resigned your position. And then keep in mind that you may have some employees that are hesitant to return. There's many different reasons why this might be the case. Maybe they're making more money on unemployment on their couch right now. That's a reason, but will be ending shortly when we lose that extra $600 a week at the end of the month. Maybe they're under a quarantine order, or maybe they just don't feel safe. So you need to determine how you're going to handle these types of requests. And I highly suggest that you consult with HR before making a determination, because depending on the circumstance will dictate how we need to handle those on a case-by-case basis. They may be protected under a federal law or eligible for leave or accommodations under the Family First Coronavirus Response Act or under the ADA. Now, for those recalled employees, there's kind of 3 different components that we want to think about when we bring them back. There's a benefits component. If they remained on any group benefits before going unpaid, how are you going to recapture any missed premiums? Keep that in mind. As the employees return too, we want to let them know about their new benefits under the FFCRA. There's a compensation component. So if salary changes were made, are you going to take those back or keep them the same? And are you going to implement some sort of hazard pay to entice these employees back? If you do, again, consult with HR, because we're going to want to put a policy in place that highlights that anticipated time frame. And then from a compliance standpoint, the government gave us a little leeway during the pandemic for remote inspection of I-9 documents. When we return folks to the office, we need to physically look at anyone that was not looked at, and then update any expired documentation as well. Now, the last thing I'm going to touch on is remote work. So, did this work well for you during the lockdown? If so, you may want to consider implementing telework as a long-term cost-saving measure. I've worked with many companies, and I'm seeing this a lot, that companies that did not allow remote work prior are really seeing the benefit in it and want to continue even post-pandemic. So if this is something that you do, of course, we want to put a teleworking policy in place. You also want to think about training employees on cybersecurity measures, making sure you have that kind of long-term plan worked out. If that's not feasible, but you want to move a little in that direction, consider staggering weeks in the office. So maybe one person works from home one week and then is in the office the following, or even alternate work days. So maybe Monday, Tuesday, employee A works from home and then comes into the office on the other days and flip-flops with their colleagues. So just kind of alternative plans that can keep less people in the office at any given time. So now that you're physically prepared, it's time to prepare your communication plan, ensure you have all policies and procedures, protocols documented, and Vienna is going to talk you guys through kind of what that looks like. I do have my contact information here for you up on the screen. I really appreciate all of your time, and I'll be standing by for questions. So thank you.
Wonderful. Thank you so much, Cassie, for that information, and thank you for the Greater Asian Chamber of Commerce or the Greater Austin Asian Chamber of Commerce, sorry about that, for inviting me to talk to you and give you some more information about returning to work also. I'm going to go ahead and share my screen. Let me make sure. Alrighty, can y'all see that? Perfect, excellent. So I'm going to go a little bit deeper into some of the policies and the communication as employers that you need to think about and consider as you reopen your business after the lockdown. Let's see, let me advance. Oops. All righty. So, this is a great opportunity for you to review all of your policies. We have some new policies that have come into place also, which is the Families First Coronavirus Response Act, which I'm going to abbreviate the FFCRA. So remember, for your companies that are under 500 employees, you must follow the FFCRA, which gives all employees up to 80 hours of emergency paid sick leave due to COVID-19 reasons. And so this includes employees from day one and all employees that are on your payroll currently. The FFCRA also expands FMLA for employees who have been employed at least 30 days and who are under the 500 employee rule there, and that the expanded FMLA is due to unavailable childcare reasons because of COVID-19. So a lot of my clients got really confused at first about this and thought that, oh, well, I have less than 50 employees, so that extended FMLA does not apply to me, but it really does apply to you. because of this, because of the FFCRA. Even though you don't fall under regular FMLA criteria, you will fall under the expanded FMLA rights that the federal government is providing due to not having childcare, which means, you know, when school was out, schools were closed. Right now it's summer, so we don't have as many concerns about that. But it also could be because daycares are closed or summer camps aren't available. And of course, these rules for FFCRA will be in effect as of right now until December 31st. So when school starts again, we may have that concerns one more time. We just don't know. So just be aware that that you must follow FFCRA. There are some exemptions to FFCRA, but really take care if you are trying to qualify to be exempt from following FFCRA. So an employer can be exempt from following FFCRA if they are in the medical field, and also if they are an emergency first responder within that field. But again, this law has been put into place to help employees. So as an employer, you really want to make sure that you are 100% for sure that you're going to be exempt from that, because you just don't want to be getting in trouble for trying to be exempt. So there are additional resources that are available that I'm going to give you at the very, very end that kind of outlines more of the FFCRA if you haven't been staying abreast of it. And, you know, of course, my presentation will also be available for you to have. So the next thing to think about and to review your policies is your call out procedures, meaning that if somebody needs to call in sick for work, how are they going to be able to do that? So if you have a policy in place, you want to remind your employees what your policy is. If you don't have a policy in place and things have just been kind of loose, you're going to want to explain the expectations to employees. So how are they going to call out? For example, are you requiring them to speak to their supervisor directly, meaning that you don't want them to leave a voicemail? Or are you okay with a text message or an email or leaving a message? How long before they are, how much notification do you need for them to give you? Are you okay with 30 minutes? Do you need it to be 2 hours in advance? Make sure that your employees understand their expectations. Cassie talked a little bit about working from home or flexible schedules. So think about that and, how you can decrease the number of people present in your office at any given time. What you really also want to think about and prepare for is if you have any positive or suspected positive COVID-19 cases. It's always better to be prepared. That way, when it comes up, and I really truly believe it's a matter of when, not necessarily if, how it's going to touch your business and how it's going to touch your employees or families of your employees. So plan ahead and really think about how are you going to handle that. And so when it does arrive, then you won't have to scramble. So how are you going to plan? How are you planning to protect your employees from additional exposure? Will you shut down? For how many days are you thinking that you're going to shut down for? And of course, how are you going to communicate all of this information to your employees, your clients, your customers? Remember, it is okay for you to say that you had a confirmed employee, an employee with a confirmed positive COVID-19 diagnosis, but do not share their name of who it is, okay? So you wanna make sure that you maintain privacy on that. But you can say that, a lot of us work in small environments and you're gonna, because there's only 5 people in the office, somebody's gonna know, hey, Bob is not here and we just got this notification. And that's okay, it's gonna happen, but you do not and should not volunteer that information, okay? Remember that the Austin's new order that just was signed last night, Cassie touched on it a little bit, is going into effect on Tuesday, June 17th, which gives, employers and customers and anybody who walks into the physical space time to prepare. The Austin order is saying that you, as a business, you need to develop and implement a health and safety policy or plan related to COVID-19. And at a minimum, you have to require all employees and visitors, which includes your customers, your clients, wear face coverings. So, think about that. And this is a great segue to my next slide, is how you're going to be able to communicate all of these policies to your employees. Remember, transparency is key. You want to let your employees, your clients, your customers know that you have planned and you have thought through and that you are prepared to keep everybody safe. So share with them what you have done. All of those things that Cassie had talked about earlier, make sure that you have communicated that to your employees. Communicate it in writing to your employees. It's so nice to be able to have a meeting like a Zoom meeting or a physical meeting where you're sharing this information. But if you could hand them, if you could email them, if you could post in writing so employees could refer back to, it's a great communication tool, and it reinforces what you've said, okay? So, think about all the steps that you're doing. Outline everything that you've done, how you're cleaning and how you're going to continue to clean. If there's a schedule to cleaning, what precautions that you're keep doing to keep the employees 6 feet apart. How are you handling meetings going forward? Are all of your meetings going to be, web-based meetings? Are you going to, not do meetings anymore? Whatever it is going to be, again, communicate, communicate, communicate. Anything that you're providing for PPE, so for sanitizer, disinfectants, even like, where they could find extras in the workspace. All of those things, make sure that you are letting employees know. Let them know what to expect. If you're doing any kind of screening, if you're having to do temperature checking, if you're having them fill out questionnaires, give them all of that information beforehand. Again, you don't want them to be surprised or taken aback by their new requirements, their new expectations. And make sure you designate who an employee could talk to about questions, and let them know directly, hey, Bob's here if you have any questions, if you need any additional clarification, whatever that happens to be. And also within this communication, make sure that you are explaining what you expect from the employee. Define when they should stay home. What does it mean to be sick? So tell them, about the, any of the, my mind just went blank. Any of, the symptoms of COVID-19. How do you define fever? Right now, the city of Austin and the surrounding areas and the CDC are defining fever at 99.6, not 10, not 100.1 like it was before. So make sure that you define those things to let your employees know. Again, remind them what PPE is required of them. Think about traveling. If they're traveling, are you going to ask them to disclose to you if they're traveling? And how are you going to handle that if they are traveling? If they're traveling by plane, if they're driving on a vacation, if they're planning to go to Cancun or to Disney, or if they're going to New York, how do you want to handle them when they return? Remind your employees about the call-out procedure. And, really remind them that you guys are all in this together, that it is uncharted territory, and that that you understand that right now there may be more stresses, there may be more anxiety. So remind each other to be kind and more patient with one another. Remember to, let them know who are they going to ask if they have additional questions. So at that, you've talked to your employees, you communicated with your employees. their expectations and what you're doing, you also have to do that for your customers, your clients, your vendors, your visitors. Again, transparency is key. You don't want your customers to have any surprises. And of course, you want to reassure them that you are prepared to keep them safe. So, you know, things like, what are there going to be requirements? Are you going to make them wear a mask? Of course, if you're in the city of Austin now, you're going to have to, you know. Are you going to ask them to wash their hands as they enter your building immediately? That's the first thing that you do. Every single visitor goes and wash their hands, or every single client goes wash their hands. If you're going to be temperature taking, if you're going to require them to sign a waiver, you know, all of those things. And then how are you going to communicate it out to your customers? You know, make sure that you do have the postings. Again, the city of Austin is saying that you have to have the postings in a conspicuous place. You know, at your front door is probably the most conspicuous place. So postings, you know, email out if you have a client list already or customer list, put it on your website, social media, you know, just make sure that that communication is out to them. And the other thing to think about is who on your staff is going to enforce all of your new policies and procedures for your customers. And help whoever it is that you designate to this, prepare for that, okay? Think about what's going to happen if you have a customer that is not willing to comply, who refuses to comply. You know, empower that employee on how to handle the situation. At what point do you ask them to leave? At what point do you decide you're going to call the police? At what point are you going to decide that you're not going to have them ever as a customer again? So again, think about those things and prepare them. That way they are not surprised if or when it happens. Of course, this all leads into training. So know for supervisors is really important in the training, because they're going to be the ones that are going to be fielding the employees' questions. They're going to be their first touch for employees. Think about the health protocols for your industry. You could see the Texas Health and Human Services website opening the state of Texas. There are many almost all industries already in there. There are guidelines and recommendations that the state of Texas and Health and Human Services has put out for each industry on how to handle things. So have them understand that. Ensure that your supervisor knows what to do if somebody comes in sick or appears sick. What kinds of questions that the supervisor is allowed to ask the employee regarding their illness. Know that it is okay to ask the employee if they're feeling ill, but keep it related to COVID-19. For example, hey Bob, you're moving a little slower, you're coughing a lot, you know, are you, you know, having COVID-19 symptoms? You know, when was the last time you checked your temperature? You know, so you keep it very specific to COVID-19. And it is okay to send an employee home that you feel like that is in danger to the rest of your staff or your customers because of an infectious you know, illness. All right. Teach your supervisors on how to handle an employee if they have fear and they don't want to come back to work. You know, again, train them on how to respond to an employee that's going to say something like that to them. Again, you just want to provide as much information as you can so your supervisors can feel empowered to handle the situation. Again, know that there's going to be higher levels of stress and anxiety due to our time. So think about what kind of mental health resources that you could provide as a company. Does your company provide an employee assistance program? Have those flyers available, have those phone numbers posted, the website posted. The Health and Human Services also has a free hotline that you can call in for mental health issues for all Texans. So have that flyer available. If your company provides insurance, check with your insurance carrier. Many of the carriers are providing free telemedicine still. So have that information available, have it ready and post it so people don't have to ask for it. I have all of these resources at the end and also on my website. So you could click on that and you don't have to remember where anything is. Again, and then also train your employees. I was on a webinar the other day, and they were talking about inspections, and they were saying that the inspector came in. It was a restaurant, and the inspector actually asked the employee, "Do you know your business's, your company's health protocols?" And so, you know, make sure that you have trained your employees on what the health protocols are. Make sure that they're posted. HHS, Health and Human Services, recommends an acknowledgement for employees to sign that they understand what the company is doing and the company's protocols for customers and for guests. Okay. So, you know, make sure that you sign that and make sure that you as a company are protecting your company. Again, you know and pass out the FFCRA. That posting is a required posting. And so make sure that your employees understand their rights as an employee, and, you know, keep up those other kinds of postings, like make sure they're doing frequent hand washing, the reminders, face mask wearing, so on and so forth, the social distancing. And again, post all your mental health resources that are available to the employees. Here's my resource page. All of this information here is on my website. If you look under my website under COVID-19 resources, and there's a lot more information. I have a quick little summary page on the FFCRA that kind of is like my cheat sheet, and all of these links are on there also. Thank you so much. My contact information is here if y'all need any additional information. And I think I'm turning it back over to Ishan right now to start any Q&A that we might have.
Thank you so much. That was really, really a wonderful presentation from both of you. It's so resourceful and really, definitely really helpful for our small business owners. So yeah, I got 2 questions from our attendees. I think it's really a good question. So either of you can, one of you can answer it if you know the answer. So I guess the biggest questions right here is that we all know that we have to sanitize our work space. So one of the questions on here is how often it's appropriate, effective. You know, is it gonna be you clean once a day, every other day? So
so I can chime in, and I'm sure Paul might want to chime in here too. But so, you know, unfortunately, there's no clear guidance on exactly how frequently we need to sanitize. However, obviously, best practice is the more often, the better, right? So it's going to depend on several different factors. So how many people do you have coming in and out of your building? Also, is there somebody there that might be symptomatic? Those things are obviously going to play into how frequently you're sanitizing. But at the very minimum, what I'd like to see is sanitize the workspace before you bring employees back into the office, and then set up some sort of protocol where each employee is responsible for wiping down their areas at the end of every day. Or if they share a workspace with somebody else, maybe they're staggering back and forth every time they leave that workspace and another person is coming in. And then of course, if you have any potential exposure in the building, at that point you would want to, again, hire out a company like Paul's and have a full deep cleaning to really ensure that the workspace is fully sanitized. So that's my 2 cents. I don't know if Vienna or Paul, you want to chime in there as well.
I think you're exactly right. How your adherence to all your day-to-day practices really determine how often. There's no disinfection service that will guarantee you protection for a duration of time. And it's just your day-to-day actions. And just like what you said, if there are incidents of primary or secondary, even tertiary infection, it might be a good idea to take a look at doing a thorough disinfection at that time.
My added just 2 cents in here is, make sure that you actually designate somebody, especially for your shared spaces. Think the break room, think the restrooms, think door handles, things like that, because you don't want to just make assumptions that somebody is going to take care of it. So make sure that you designate that person and have them do it on whatever routine that you decide, if it's going to be once a week, once a day, whatever it happens to be.
So also you can customize your disinfection service. It sounds like I'm advertising again, but you can do a thorough cleaning. Then you can do those intermittent, like high touch areas disinfection. If you know there's a lot of traffic or a lot of exposure or potential, you can touch up those areas, and we provide those kind of customized services as well. And a lot of your vendors will do the same thing.
Great. Yeah, that's definitely a good suggestion. I have a second question right here. Would the City of Austin Health and Safe Plan qualify as a health protocol? Because we have a policy coming from CDC, federal level, and also so would the City of Austin, their health plan actually qualify for, the protocol?
So this is Vienna. I'll chime in. How I read the order that was just passed, it says that, hold on, let me find where I read it. You must develop and implement a health and safety policy or plan. And it says at a minimum, it needs to say that your premises or other facilities and everybody who enters them, including your employees and visitors, must wear face coverings. So, according to the order, the new order that just passed, that's the minimum they're looking for, okay? Again, if you go to Health and Human Services, it has a lot of recommendations that you could pull straight from there and implement as a policy.
Okay, that's great. I got a question here. I'm just wondering, because now that I know the process is, people are talking about testing and also contact tracing. Will you recommend small business owners to have some sort of policy in place? When someone comes into your building, you trace those records?
So from a business perspective, what I would recommend at this point is really only tracing when you know of a positive case. So when I have a positive case, what I'm going to do is approach that employee, or whomever was in the office, and get clarification on all of the names of folks that they've come in contact with in less than 6 feet within the past 14 days. Once I have that list together, then I'm going to start contacting each person on that list, to Vienna's point, hiding the person's identity and keeping that confidential, but letting them know of a possible exposure. I assume, and this is just an assumption, but I believe that the CDC or possibly even the EEOC will start releasing more specific guidance on what an employer can or cannot do when it comes to contact tracing. But just a little side note, just yesterday, the EEOC kind of put some clear guidance out that we can not look at testing employees for antibodies, which was kind of a hot topic of conversation just a week or two ago. So I just assume that we're going to get a little bit more clarification on the contact tracing as well.
Okay, great. I guess we don't have a questions here. Do any of you have anything you want to add on before I close the webinar?
No, this was great. For me, I just want to say thank you all so much for your time and for inviting me to come speak to you all. I really appreciate it.
Well, I also appreciate all of you. It's really a great information, of course, to our small business owners. So thank you again to our speakers today and also to Paul. So I will be sending an email to all of you today and with all the speakers' contact information. So if you do have any questions, please feel free to contact them directly. I also want to mention that next week, we also have 2 events coming up. Next Wednesday, we have a BCL workshop on Travis County Small Business Grant. Thursday, we also have the economy talk with George Say. So make sure that you RSVP to those events if you want to attend. And have a great day, everyone. Thank you so much.
Thank you all.
Thank you.